Discuss research and survey methods. Research methods or survey methods are techniques. They identify a problem. We analyze the problem, or we collect the data, then we analyze the data, and in the end, we do plan, we do implementation to control that problem. We are concerned with research of disease. We are concerned with research in human beings. We try to search, we try to find something. We'll discuss this lecture. What is research? Systemic collection. We collect the data, then analysis. We do analysis. And in the end, we interpret the data to answer a certain question or to solve a problem. Like we create a question, we formulate research question, then we collect data according to that question. Then we analyze this data and we interpret our results and try to answer this question. This is called research. Now we'll discuss components of research protocol or research proposal. First of all, we need to select a title. We need to select title of our research project. Then we need to summarize it. Then what is scientific justification of selection of this topic? Like we select hepatitis B in our population as it is common in Pakistan. What is justification? It is common due to aseptic measures. It is common due to blood transfusions. It is lethal. It can cause mortality. And it is increasing the burden of disease. Then, where this is applicable, then we perform theoretical framework. We answer the questions. We formulate the hypothesis. What are our objectives? What we want to achieve? What are our general objectives? And what are specific objectives of our research? Then methodology, very important. Which type of study we are going to perform? What is study universe? Type of study and study design. Like we are performing observational study or we are performing a randomized controlled trial. Which type of study we are doing and which variables are used, whether they are qualitative or quantitative. What are operational definitions? What are precise definitions used in the study? Sampling unit. Then we need to draw selection criteria according to which we select our sample. Sampling technique, probability sampling, non-probability sampling, and we need to identify sample size. We need to calculate sample size. And if intervention is applicable, like in experimental studies, we'll propose certain intervention, like we'll propose certain medication, dose of medication. And data collection. From where data should be collected? We can see the record, hospital record, observations, interview. We can do interviews. We can use certain instruments. We can use test questionnaire. Then we need to control quality of that data. Ethical consideration is very important, that our research should not harm anyone. Pilot study is done before actual research. Then we need to plan for analysis of our results. How we'll analyze the data. It is analyzed in certain softwares like AppInfo, SPSS. It is also used. Statistical package for social sciences. Then we'll do referencing. We must have certain timetable. Budget is required to perform the research. Start with title. Title should be precise. It should be short and accurate. It should describe the research. It should identify what to investigate, in which population, and it should provide keywords. So a title should contain time, place, and person. It should contain time, place, and person. Like these are few titles: heart failure in diabetes. Heart failure is common in diabetic patients. Tuberculosis in HIV infected children, it is common. But there is no time, place, person. These are incomplete titles. Factors affecting punctuality in class attendance among students at Islam Medical College, Sialkot. Punctuality in class and result outcomes. They are interrelated. Those who are punctual, their result is better. Prevalence and determinants of protein energy malnutrition among under 5 in rural community. Because malnutrition is common in rural community. So we need to add heart failure in diabetics in cell code. This is place. Diabetics are person. And we need to mention time from July to August, our study time. Factors affecting punctuality in class attendance. Students are study universe in Islam Medical College Sialkot. So this is the complete title. Now we need to summarize our project. What will be the abstract? Abstract, remember, it should not be more than 1 page. Preferably there should be 3 paragraphs. Then rationale and objective should be added. Methods, population, time frame. In third paragraph, analysis and expected outcomes. What is statement of problems? We have to justify our study. So there should be scientific justification. There should be knowledge gap and study generate new knowledge. We should fill these gaps. We should bridge these gaps. Need to test what is known. It should be supported by references. References must be given. So sequence of problem statement. Magnitude should be higher, frequency should be higher, and distribution of problem according to time, place, and person. What are the causes of this problem? Whether current knowledge is sufficient or not, and what should be the possible solution? You have to provide the solution in the end. What are unanswered questions? Certain questions are unanswered. We need to answer. We try to find the answer of these questions during our research study. Then literature review is done. Literature review. We need to review previous literature. We need to review previous studies regarding our subject or which are related to our title, which are related to our project. We need to review them. We need to summarize them. Methodology should be familiar. Why we need to summarize them? Because it helps in developing arguments. We need to develop arguments. We need to develop questions. We need to answer them. Then we need to disseminate our results. Why it is disseminated? How it is disseminated? We can disseminate them in a workshop, in a symposia, policy consultations, and in publications. People should know what we have done, how our research is beneficial, why our research is important, because they can help in changing the policies. We can make policy on the basis of our research. Like we say that hepatitis B is increasing in our community due to intravenous drug abusers or intravenous drug injection. So we need to formulate a policy regarding injections. This will be helpful in our policy. Who are the beneficiaries? Definitely patients, common people, all the age groups or specific age groups. Patients get benefit, pregnant women can get benefit, specific age group get benefit, policymakers, they get benefit from the research. When we disseminate our research in workshops, in symposia, they get knowledge. They get the answers of their questions. So it helps in developing a policy. It helps in developing health policy. The objectives. Remember one thing, objectives should be smart. Objectives are the answers. They provide the answers. Basically, objectives are the questions. Questions we are asking in our research and try to provide the answers. So they should be specific. They should be logical. Objective should be measurable in operational terms. Like we say that we need to measure the burden and measure the prevalence of cholera or prevalence of hepatitis B. So we need to measure it. We need to specify hepatitis B. In which population? Achievable. Results should be achievable. Like we need to specify a population so that we can achieve the results. If we specify whole country, results can't be achieved. They should be realistic. They should be relevant and traceable. They should be monitored. They should be time sensitive. Time is very important in conducting a research. Research should be time bound. And certain verbs are used like to determine, to compare, to verify, to calculate the burden of malaria in the community. These verbs are used. They should be used. So remember this. While formulating objectives, we use to calculate the burden of malaria, to describe the burden of malaria, to describe the burden of hepatitis B, to appreciate the people, to use septic measures. These are general objectives. A study factor influencing utilization. For example, we take example a study of factors that are influencing utilization of antenatal care services in district Sialkot. This is our study. What are general objective? We need to assess factors which influence utilization of maternal health care services. This is general objective. What are specific objective? We need to assess the knowledge, attitude, and practice of pregnant women regarding antenatal care. Whether pregnant females are using antenatal care or not. What is their knowledge? What is their attitude? How do they practice? To determine availability of antenatal care services. Whether they are available or not. To identify factors that influence women attendance in antenatal care or at antenatal clinics. Why attendance is low? What is their level of knowledge? To formulate recommendation. In the end, we'll do recommendation. We will give recommendation. How can we bridge these gaps? How can we improve antenatal services? How can we improve knowledge of pregnant female? These are the questions. These need to be answered in our study. Certain variables are used and operational definitions are used to conduct a study. Variable is a measurable thing. It clearly describes that whether it is continuous variable, dependent variable, independent variable, it is qualitative variable or quantitative variable. Which type of variable is considered, which type of variable is used in our study. We need to categorize the variables. We need to measure the variables. And types of variables. Two important types of variables. There is independent variable and there is dependent variable. Independent variable that is responsible, that can be manipulated, that can be changed by the researcher. Like you are conducting a research regarding dose of atenolol. So you can manipulate the dose, you can change the dose, you can increase the dose, you can decrease the dose of atenolol. This is in our control. This is independent variable. What is dependent variable? Outcome. Change that independent variable brings a change. Like you increase the dose, BP falls. You decrease the dose, BP remains stable. This is dependent variable. Effect is dependent. Dose is independent. That is in our control. Or temperature is in our control in a certain study. We can increase the temperature. We can decrease the temperature. We can increase the dose. We can decrease the dose. These are independent and dependent variables. They are used in research. Like examples of operational definition. It should have age, family size, use of clinic, hemoglobin. Operational definition, age at last birthday. That should be counted in months. Variable can be discrete also. What is operational definition? It is precise definition or accurate definition. Precise and accurate definition used in our study. We select our sample according to operational definition. Like we say that operational definition should consists of signs, symptoms, and diagnosis. Presence of high grade fever with gradual onset, with stepladder pattern, with relative bradycardia, which shows blood culture positive is typhoid. That is operational definition. People who fulfill this criteria are included in our study. Those who don't fulfill this criteria are excluded in our study. So we must give operational definition to conduct a research project, to conduct a research study. These are various examples. Patient satisfaction level, immunization coverage. These are examples. Operational definitions. Examples of variable. They can be classified according to occupation, according to age, according to income. Like occupation, doctors, nurses, education, masters, PhD, bachelors, income, low income, high income, social status, socioeconomic status like upper class, lower class, middle class, marital status, those who are married or unmarried, single, divorced, widowed. What is study universe? Study universe is the entire group of units, is the entire population in which we focus. This is the population that consists of all persons in the country. Study universe can be whole country, whole district, whole division, whole world. We select sample from this study universe, then apply the results. What is study design? Research design. There are various types of studies. You know that there are observational studies and there are experimental studies. There are descriptive studies. There are case control studies. There are cohort studies. We can do randomized controlled trials. We can do non-randomized controlled trial. We have to select a study design, whether we are going to perform observational study or experimental study. Experimental design, like randomized controlled trials. They identify the cause, they provide the exact cause. Observational study design, you know, that descriptive study design, analytical study design, cohort, prospective study, case control, a retrospective study. And this is hierarchy of studies. First we perform ecological studies, then we move to cross-sectional studies, then case control studies, then we move to cohort study, and then we perform randomized controlled trial. This is a pyramid of studies. First, we have to do observational study, then we'll move step by step to analytical study, then experimental study. Cause experimental studies provide exact cause. We need to know the exact cause. Experimental studies have given the evidence that Pragra is not an infectious disease. It's disease caused by deficiency of vitamin B3. This is study population. Study population has certain subdivisions. We need to know the composition of our population according to age, according to gender, according to occupation, according to socioeconomic status, according to marital status. Then we select then which are the participants. It depends on type of study, whether we are performing experimental study or performing descriptive study, whether we are performing case control study or cohort study. We have to formulate inclusion or exclusion criteria. Which person should be included? Like, if we want to study diabetic type 2 in female, we should include female of middle-aged female. All those who are non-diabetic can be excluded. They should be excluded from the study. Like, we want to study effect of diabetes on heart, so we will take people who are suffering from heart disease due to diabetes. So we need to select our sample according to inclusion criteria and exclusion criteria, or we exclude those who are at terminal stage or those who are bedridden. Sample size, it depends on variables. Remember one thing, sample size can be increased or decreased on the basis of variables. Sample size can be determined, it can be calculated. Why sampling? Very important question. Why we do sampling? Reduce the cost, to save the time. We can't include the whole population in the study. We need to take sample which should represent the population, which should have same characteristics of total population. We need to take a sample in order to save our cost, in order to save our time. Certain calculators are used. Epi info calculator is used to calculate sample size. If you increase variable, sample size increases. And what is proposed intervention? This action should be prepared on the basis of research objectives. We need to evaluate. Generally, there are comparative studies with experimental studies, other designs. We need to compare. We need to propose our interventions. Then we will move to data collection. Data is collected, and there are certain data collection tools. Collection methods are record review. This is secondary data. Data is primary and secondary. Data which is collected directly from person is primary data. Data that is collected from other measures like from hospital, that is secondary data. We can do interviews. We can do certain tests, lab investigation. If we are performing some trial, lab investigations are necessary. Data should be collected from questionnaire, from interview, from laboratory, indirectly or directly. Quality of data should be controlled. So we need to train the researchers. Researchers are persons who are involved in research. They should be trained. We need to monitor that data. We need to monitor that data collection. Desk monitoring can be done. Electronic record. Gadgets can be used like laptops, tabs. Ethical consideration. Our research should not harm anyone. We need to get approval from ethical committee. They are constituted in institutions. We need to get their approval. We need to explain our study. We need to explain our short-term, long-term risk. Then we can conduct the study. So ethical approval is mandatory. Ethical considerations are mandatory to conduct the research, especially in experimental studies or in cohort studies. Ethical considerations should be taken into account before conduction of these studies because they can provide harm. Like we are conducting a trial on a vaccine, it may provide harm. We are conducting a trial on antihypertensive drugs, it may harm. We are conducting a trial on antibiotics, they can produce adverse effects. So ethical consideration is mandatory. It's an integral part, it's an integral pillar to conduct a research. Decision making should be informed. We need to take a consent from participants. We need to provide them a statement that describes the nature of studies, that describes the adverse effects. We need to sign a certificate. It should be written. Plus, it should be written in simple language, like Urdu is used in Pakistan. So we need to write the consent in Urdu and we need to explain this consent to all the participants, all the subjects, and especially our population is not educated. So we need special care. We need special attention. They need special attention. We need to describe in easy language, in simple language, in their mother language. Some people don't understand Urdu, so we need to explain in their mother language. Some people don't understand English. Even educated person in Pakistan, they don't understand full English. So we need to explain it. We need to explain our research. This is an important part. Then how data is managed. Data should be summarized. Data is the information that we collect from our participants. So we need to code that data. Then we need analysis, then monitoring and verifications. Personal names should not be used. We need a plan for data analysis and results. What are various methods that are used for data, for analysis of data? Remember a software, SPSS. This is used for analysis of data. We need to tabulate the data. Or we can make 2 by 2 table on the basis of disease and non-disease, people who are exposed and non-exposed. If we are conducting a randomized control trial, case control study or cohort study, we can make a 2 by 2 table, like we are saying that smoking causes lung cancer. So whether lung cancer is present in exposed people or it is absent in exposed people. How many people who are exposed to smoking get lung cancer? How many people who are not exposed to smoking get lung cancer? Lung cancer can be present in non-exposed. So we can draw a 2 by 2 table and analyze the results. We can calculate odds ratio, relative risk. We can calculate incidence. So these are various measurements that are calculated. And data should be presented. How we present the data? Data can be presented in the form of charts, bars, tables, diagrams. These are bar charts. They show two variables, relation of two variables, more than one attribute, more than one variable, like these are various countries, Latin America, Africa, Europe, Asia. We see the burden of certain disease. We can do, our data can be presented in form of bar charts, pie charts, according to angle. They describe the data according to angle, like there is 360 angle. Total angle is 360 degrees. So 1% is equal to 3.6 angle. We can present data in the form of pie charts. Then we must need to reference. We must provide references in the end. Number of articles which are used, their reference can be given. Articles, tables, charts, they are used, their reference can be given. There are two common style, referencing style, Vancouver model, Vancouver method, and Harvard style of referencing. Both can be used. A reference should provide information regarding authors, regarding journal, regarding date of publication, regarding page of their journal. So every reference should include all this information. We need referencing. Timetable is very important because time is precious. A work plan. We need to do a timetable. We need to make a timetable in which time we will complete this research, which tasks are performed, We need to perform various tasks in research. They are performed according to time guideline. Like we need to plan activity. We can context the review, development of work, how we'll do arrangements, training, data collection, data analysis, report writing and sharing, and final report. We need to formulate a time plan. We need to give an activity plan because we need to save time. That's very important. Budget is required. Funding is required to perform a research. We need to hire people. We need to analyze data. We need to purchase softwares. So budget is very important. Budgeting. We need to give budgeting. Who will provide this budget? Certain organizations like WHO, UNO, our government, they provide the budget to perform the research. Our institution provide the budget. So we need funding, we need sources of funding, but we need to justify why we need this budget, why we need this money, why we need this much money to perform our research. Like randomized controlled trials need money. Because we have to hire people, we have to give medications, we have to give vaccinations. They can be made available by money, by budget. So we need to summarize that how much funding is required, how much budget is required. Like cohort study, they may be expensive. So we need to take this factor into account before the conduction of study. We need to take in account our budget, our budgeting resources. Like if you have lesser resources, you can perform a cross-sectional study. You can perform case control study. Greater resources are required to conduct cohort study because it is time taking. Randomized controlled trial, non-randomized controlled trial. So budgeting is very important. We need to break down the funds. We need to request higher authorities to provide funds. Now, we'll summarize it. How we'll do a research project. First, we need a title. Title should be complete. Time, place, person should be included in title. And justification. Why we are performing this study. There should be some scientific justification. Then, literature review. We can review literature, previous studies which are related to our topic. Then, we need to formulate our research objectives. Remember, objective should be SMART. They are specific. They should be measurable, accessible, realistic, traceable. Objectives are the questions which we ask. They are our study questions. Then, after the formulation of objectives, what will be our methodology? What is our study design? Sample size, inclusion exclusion criteria, how we will collect the data, how we will analyze the data. This is our methodology. Certain software are used to measure sample size. We collect the data, we will analyze the data. This is methodology. Which type of study we are going to perform? We are performing observational study or experimental study. Study design depends on our study question, on our title. Methodology. Then, after analyzing the data, we will disseminate the data. We will present the data. Data should be presented in form of charts, tables, and we'll do referencing. A reference should contain author name, journal name, publication date, page number of the journal. Then we need time frame. Time frame is very important. In which time we will complete this research. Budgeting. Funding is required. Conduct a research. So, in short, we can say that research is a systemic collection of data. We need to collect data. Then we will summarize this data. Then we analyze this data. Then we disseminate this data. Why? To answer a certain question. Question that is asked like prevalence of diabetes, prevalence of malaria, prevalence of hypertension, in current scenario, prevalence of coronavirus, morbidity due to coronavirus. If we want to calculate the morbidity, mortality due to coronavirus, we need to collect data. We need to identify data. Data can be primary or secondary. Remember this. We can ask questions directly from person. We can get data from hospital records. Then we'll select the title. Title must contain time, place, and person like prevalence of anemia in pregnant women in hospitals in Sialkot. That is complete title. Then certain variables are used in research. Variables are independent and dependent. Independent variable which are manipulated, which can be changed, which are in our control. What are dependent variables? The affects outcomes like dose is in our control. Effect of that dose is dependent variable. We need to give operational definitions, precise, accurate definitions. We need to form a criteria which people should be included. Then we need to formulate objectives. These are search questions. They are specific and general. You must remember this. Objectives are specific and they are general objectives. Then we do literature review. Then we'll start collecting the data. After collection of data, it should be summarized. Certain methodology is used in research. Which type of study we are going to conduct? Observational, experimental. We need a study universe. We need a study population. Then we'll collect the sample. Because we can't include the whole population in our study. We need cost effective measures. We need to save time. We need to save money. So we take a sample. Sample size is calculated. Data is collected. Data is summarized. Then data is analyzed. Certain softwares are used, like SPSS, Statistical Package for Social Sciences. It is used. And data should be presented in forms of tables, diagrams, like we made 2 by 2 table in case control study and cohort study, and in randomized control trial. Then we measure incidence, we measure odds ratio, we measure relative risk, we measure attributable risk, we measure risk ratio after making 2 by 2 table, and then we interpret our result that prevalence is higher, attributable risk is higher, relative risk is higher, there is positive association, there is negative association. On the basis of analysis, we interpret our results and try to answer certain questions that are asked in our study. And we must give recommendations, we must give suggestions how we can improve, how we can reduce the burden. Like if we are performing a study of coronavirus, burden is increasing in Pakistan, people are dying, people are getting the disease, there are complications. So we need to give suggestions how we can reduce the mortality, how we can reduce the morbidity, how we can reduce the complications, which preventive measures should be taken. We conclude our research. In the end, we'll conclude, we'll identify the causes, we'll write the abstract, we'll do referencing. Remember, budgeting time frame is important. Plus, most important thing is ethical consideration. We need approval from ethical committee. We need to perform. We need to give written informed consent to participants. They should know about the study. They should know about the harmful effects of study. Written consent should be in simple language, in their own language, in their understandable language, in their mother language. We need to explain their effects. Ethical consideration is important. We should not harm anyone. Like we are conducting a study on smoking and lung cancer. It's a cohort study. So we need to prevent smoking. We can't allow a person to smoke for 20 years. We can't wait to see that he develops lung cancer after 20 years of smoking or not. In certain circumstances, we need retrospective studies. In certain circumstances, we need prospective studies. Remember, we start from descriptive study, then we move to randomized controlled trial. We do referencing. Basically, research is a practical thing. You need to know the basic template of research, about the title, about the objectives, about the literature review, about the methodology, about the sample size, about the sampling techniques, about the discussion, about referencing, as we have discussed whole epidemiology. So you must know about the type of studies, about the methodology of studies. You must know how to interpret the results. When you perform, you can make changes. So few things can be remembered, few things should be remembered to conduct a research study. It should depend on scenario. It should depend on available resources. If you have no lesser funds, you can do descriptive studies. Certain studies depend on budget. They need higher budget. They need time. You need to see your time frame. You need to see your limitations. You must consider your limitations before conducting a research. You can perform a pilot project before conducting a research. So these things should be taken into consideration before conduct a research study. Basic knowledge is important. You must know about the type of studies. You must know what is observational study, what is descriptive study, what is case control study, what is cohort study, what is randomized control study, what is their framework, what are their calculations, how can we interpret the results. You need to know about certain software like SPSS, AppInfo. AppInfo is used to calculate sample size. SPSS is used to interpret, is used to analyze data. You must know the interpretation, like bar charts, pie charts, pictograms, frequency distribution tables. You must have knowledge regarding variables. What is independent variable? What is dependent variable? You must have knowledge regarding operational definition. Then you will perform practical research. Unfortunately, there was no emphasis on research in countries like Pakistan. People are not doing practical research. Doctors are doing practice, but they are not collecting data. We need to collect data. Why? To control the disease, to control the burden of disease, to reduce the mortality, to reduce the morbidity. Like certain cases are coming from a certain place. Environmental surveillance is required, data should be collected, authorities should be informed. We need an integrated approach, research based approach. We need research in order to control our disease burden. Burden of both communicable diseases and non communicable diseases is increasing in Pakistan. We have limited data. Patient record is not maintained. We need these basic things. We need to maintain the record because they will be helpful in making the policy. Ultimately, we need to make a policy to control the problem. And policy should be made on the basis of certain data, on the basis of background knowledge. We need to collect, we need to do these little things in order to control health problems. What Europe has done? They emphasize on research, they emphasize on data collection, they have patient records. Hospitals know that which patient is coming to them with which symptoms. Unfortunately, in developing world, we don't have any record. We don't collect data. We don't perform research. These are the basics. Without research, you can't control the disease. You can't eliminate the disease. You can't eradicate the disease. You can't reduce the mortality. You can't reduce the morbidity. Like we are collecting data regarding coronavirus on daily basis. We have data. How many people are vaccinated? This is a good thing in our country now that we are collecting data regarding vaccination, regarding mortality, regarding morbidity, regarding number of cases, regarding mode of transmission of coronavirus nowadays. It is helpful. We know that 20 million people are vaccinated in Pakistan up till now. We need booster dose. Who need those? Who need vaccine? So policymakers are getting benefits from this data collection. It should be emphasized. Research should be emphasized. So we need research. We need evidence based research, purpose based research. That's all.